Hello, I'm Dr. Philip Gamble. I'm a chiropractor in St. Charles, Illinois at White Oak Family Wellness. This is Dr. Shah. She's going to be my demonstration patient for today. Today I wanted to show you a little bit of what we do for people who come in with neck pain. And for starters, of course, the first thing we always do is a thorough examination. We want to make sure that we are able to have a solid diagnosis for you, to be able to tell you what's going on, and we want to be able to make sure that chiropractic is the right choice for you, and not that we need to send you out, for some other sort of medical evaluation. But if, of course, we get to a point where we decide that chiropractic would be the right route for you, and you want to move forward, we would wind up to a similar position than where we're at right here. Right now I'm just working on the muscles in the neck, doing a little light massage, addressing the major tight muscles that she's experiencing, which are actually fairly typical of neck pain patients. Right here I'm working a little bit on her suboccipital muscles, very, very common for people with neck pain. This is the area at the top of the neck and the back of the bottom of the head. Tends to get very tight for people, especially people who spend a lot of time at a desk on a computer. It kind of comes along if you've got some issues with your posture. Another good site is right where I'm at here, behind the ears, because that's where a lot of the muscles that come all the way from this upper trap region here actually come up and attach right here behind the ear. And they get pretty tight for most people and can cause problems. Usually I do a little bit more work on the upper traps themselves, which is right here on the upper shoulder here. Levator scap, which is a little bit farther back and comes up, but that's a little bit easier to do when she's face down, so I won't be showing you that today, but we do work on that as well. Really want to make sure that we can relax the muscle, make her feel better here. And then I like to do a little light manual traction, which just means pulling a little bit to traction the neck. It stretches the muscles, it gaps the joints a little bit. Most of my patients say this is one of their favorite parts. And like I said, this just helps to stretch muscles, traction neck, gap the joints a little bit. Feels pretty good. And then I'll start assessing each segment in the spine up here, assessing one motion at a time. Right here, I'm checking lateral flexion in the first segment, which is like if you were to bring your ear to your shoulder, that's like side bending lateral flexion. You can already tell she's a little tight here on the left. Moving down one segment at a time, still feel that tightness on the left. It looks like it's spanning a couple of segments here. And check a little bit of that back to forward motion. What I'm really finding is a restriction here on the left in this left lateral flexion. What I'm going to do is palpate the muscle around. Usually we find a lot of muscular tightness in that area, and I am finding that here. Some tenderness, which I'm assuming is pretty tender. Now that I know where I'm going to adjust, I'm going to go ahead and get set up. The first thing I'm going to do is just kind of relax her head here on my arm. Now this hand isn't actually going to do anything, it's just here to support her head and make her feel comfortable. So like my hand is here, but really only for support. It's not going to be doing any of the work. going to contact this upper segment that I found was not moving well before. And then just give it a light little nudge. And then now that we've adjusted it, we want to go back and make sure that it moves better. So I'm going to go back through. And I can already tell it's moving a lot better on that left side. The muscles are very relaxed now. Is it less tender?
Yeah.
It's less tender. And I didn't really find anything else that was restricted in our necks, so I won't be adjusting anything else on our neck today. You know, we only work on the things. If there's a problem there, we work on it. If there's no problem there, you know, we're not going to mess with it. And we actually work a little bit longer in each patient, both the soft tissue massage component, and obviously with her neck, I would usually be working on her upper back a little bit more as well. But you know, for the purpose of this video, we're just going to keep it kind of short and sweet. If you have any questions, feel free to call us, or you can make your appointment and call us at the number we put below. And thank you for watching.